Peace be to you all. Assalamu alaikum, Omar here. Okay, it is a Sunday, relatively long one. Putting in about 8 miles, or 7. Okay, so for those of you guys that don't know me, I am my doctorate in health education. I am a moderately fit, middle-aged endurance athlete, a physician assistant, now called a physician associate, and family man. So we are in the tail end of April, and for those of you guys that are applying to PA school, those of you guys that are pre-PA students, this is the time to get your stuff in, all the requirements in, so you can submit it to CASPA. I did some previous videos on advice about that, but I wanted to talk to you guys about what you should expect, or what you should demand from your PA program. Because teaching, especially on the collegiate level, especially on the level of PA, because it's a graduate level program, it's a service oriented business. It's very expensive. So you as the consumer, i.e. the student, should have very high demands, just as the programs have high demands of you. So you should demand a lot from your professors and the administration. So, having said that, I have come to the realization that not everybody who has degrees behind their names are necessarily teachers. And I include myself in that. There's things that I can teach very well. There's things that I refer to somebody else, even when I'm in, working with my patients, those that have poorly controlled diabetes. If we've kind of gone back and forth with insulin regimens and anti-glycemics and that kind of things, and lifestyle management, and the person still has a hemoglobin A1C in the double digits, I refer them to a diabetic educator. And I said, listen, and a diabetic educator is usually a nurse, an RN who's got some moderately advanced training in how to manage people's diabetes and help them with it. So it takes humility on that. I got to say, listen, I don't do this as well as I think you need somebody to do it. So let me refer you to a diabetic educator and refer you to an endocrinologist. That's somebody who deals with the endocrine system, which is part of the diabetes. It deals with the pancreas and affects other organs. So there's that. You should have professors who are going to be disseminating information to you in an effective manner during your didactic years in particular. But also we're humble enough to say, listen, I don't know that. I've had one of my mentors, Dr. B, I would try to ask him, incredible ER doctor, who's directed one of the most inner city, gangbangers for patients places in Washington, D.C. Just amazing. And he turned out to be a really great educator and mentor for me. And he would not answer questions that were outside of his specialty. I'd be like, hey, what about this? What about... He says, listen, that's not my specialty, so I'm not going to answer that. I'm like, yeah, but that's not my specialty. I'm not going to answer that question. And I saw the wisdom in that. It took me a while, because when you're disseminating information to people and you're incorrect, that person will carry it to somebody else, or even worse, act on it and do damage. So this is very important in medicine, when you're teaching medicine. And I include nursing and even medical assistants. I've taught medical assistant students before, because it's all about taking care of patients. So if you say, well, this is this, and this is how you should do this, and you're wrong, and you've let your ego speak for you, instead of saying, look, I do not know the answer to that question. I can refer you to somebody who knows that. That's the proper thing to do. So you should use students who are applying, even if you're applying to med school this year too. You know, demand a lot of your professors. Your professors should be prepared to teach you. They should be able to effectively disseminate that information to you, whatever class they're teaching, you know, such that you do well. Now, you gotta study. You gotta study. You can't be, he didn't teach this correctly. You can't just sit there and passively take the information in. You have to be disciplined. But you should also require that your professors and your administrators, the folks who handle your paperwork, are disciplined as well. All right, that's it for now. If you guys want mentorship from me, if you are a pre-PA student, pre-nurse practitioner student, or pre-med student even, I do that too. Feel free to contact me. And if I don't have the answers to your questions, I will refer you to somebody who may. Take care. I wish you guys the best of success in your positive endeavors. Peace. Check out this beautiful Washington, D.C. This is Rock Creek Park, man. All the foliage is out now. It's gorgeous out here. All right, guys. Peace.